Welcome to the Track to AI podcast, your guide to the most impactful AI and tech solutions powered by Chetu. I'm your host, Leonard Goffe, and I love discovering how the right technology can move businesses forward. I speak with experts about everyday tech problems, and we share solutions that actually work. From AI integration to practical use cases, you'll get the clarity you need to make smarter decisions for your company. If you're ready to stay ahead of the tech trends, yes, you've come to the right place. It is time to get on track. Hello everyone, Leonard Goffe here, your favorite tech nerd. We're already 4 episodes deep into the Track to AI podcast, and if you're enjoying the show so far, and you know you are, please share it with your fellow tech leaders and nerds. Now, recently, I took my wife to the hospital for a procedure. Nothing major, everything's fine. But finding the right room was a challenge, to say the least. I mean, there's hundreds of rooms in that 6-story building and a really nice cafeteria. But it was amazing there. So now just imagine each hospital room is like a patient data center. Massive amounts of important patient data are produced around the clock. Everything from vital signs to medication doses and so much more. So how do hospitals manage patient data, extract insights, and make sure it's in the right hands? And an even bigger question is, how can companies outside of healthcare do the same with their large data sets? With me today, Roland Burrell, and he is the Digital Transformation Director for Healthcare at Chetu. We're going to hear from him in just a bit. Now, as I've said in previous episodes, data makes AI work. And data is especially important in the medical field. In fact, healthcare data isn't just increasing, it's exploding. According to Statista, the amount of global healthcare data was expected to increase to 2.3 zettabytes by 2020. And for those of you who don't know, a zettabyte equals 1 trillion gigabytes. No, it's not your aunt in Brooklyn. Now, for context, back in 2013, there was less than 1 zettabyte of global healthcare data. I can only imagine how much more data the world will have by 2030. Technologies like EHRs, imaging, wearables, remote monitoring, and others are driving this new data. So yeah, we have a lot of data, but how do we turn that data into insights? Thank you for being on the show today, Roland. We are so happy that you're here. Now, before we get into healthcare data, I know you have a lot of coaching experience. Tell me about the sports that you coached and what ages.
Thank you, Leonard. It's a pleasure to be here. So yeah, I've got a long history of coaching, and it actually began with a women's softball team, working at a business, and they asked me if I would coach them, knowing that I had played a lot of sports. So those were 18 and up. Then from that, I got into coaching. I've coached youth leagues from 8 to 12. Both coached them football, basketball, baseball, soccer. I've coached adults in soccer, both indoor and outdoor, kickball, baseball, football, and as well as teaching skiing to adults and children alike, as well as snowboarding.
Do you coach golf? Because I really need some golf lessons.
If I can talk a good game in golf, but if
Okay.
my friends would say, I'm probably a better coach than player at golf as well.
Okay, I'm going to have to go back to YouTube to learn how to play golf. Skiing is good, but there's no mountains in Florida that we know of.
Yeah, but here's a fun fact. The largest ski group in the United States is actually located in Florida.
Oh, well, that is good. And it did snow in a couple parts of Florida recently, so you never know. They might have Florida skiing schools.
There you go.
It could happen. Now, with all this coaching, people who coach learn so much quicker, and they're able to turn that learning and teaching experiences into other aspects of their lives and the people who they coach in other areas. So, what have you applied from what you've learned to coaching to your current role at Chetu?
That's a fantastic question. Anytime you're coaching, you really have to look for the qualities in each individual. You're going to have those that have natural ability, those that need to work at it a little bit, those that are really the go-getters and they're trying hard. And then you'll have those that are just there because.
Okay.
So working, and relaying that into people leadership, it's the same thing as looking for the qualities in the people and understanding what their motivations are and coaching them to that effect. So you have to be very versatile in order to help everybody achieve their goal.
That is so true. So, for our audience, can you talk about the sheer amount of data produced by medical facilities in the age of data-driven AI?
Absolutely. I mean, with the current population, especially an aging population, healthcare is probably the most data intensive industry in the world. I mean, the volume grows exponentially. You're looking at every patient interaction. There's more data from electronic health records. There's physician notes. There's lab results, imaging files, prescriptions, claims, scheduling. Now, even now, you have data from remote monitoring of wearables. In home care. It's just unbelievable, all of the different areas that are growing in healthcare.
And I'm understanding that the regular patient room today is giving you as much data as an intensive care unit, say about 3 or 4 years ago. Would you say that's correct?
Oh, absolutely, absolutely. And it's not just the volume of data, it's actually more complex data than we've ever had before.
And it is tough with all these different systems and all these different devices to get that data in there. I wanted to go to a success example of a healthcare company that has done it right. So there was a nonprofit health system called Intermountain Health, and they've been using data analytics to improve patient care for the past 40 years. Now, I know AI is a bit more recent, but we've had a lot of data throughout the years. And their team gathers and analyzes data from cardiovascular care, endocrinology, surgeries, and a lot more. So this enabled them to use clean, trusted data and insights to discover patterns that doctors might miss. It also means they could create highly personalized experience for patients. And that's what they need. When I go to my doctor, when I go to my dentist, I just had a new crown. They knew exactly what I needed. They measured the inside of my mouth with some laser thing. And it was amazing that they were able to produce an exact crown for me in that day.
Yeah, it's no more wooden teeth.
No more wooden teeth or golden teeth.
Exactly.
So using and managing healthcare data properly is good for everybody, you and me, hospitals, medical professionals, and especially patients. But there is a challenge. Now, in a recent survey by Sage Growth Partners, only 20% of organizations fully trust their data. That's not good. I want 100% trust in my data. So as a patient or provider, you're going to want that clean, trusted data. And one thing that stands in the way is data silos. And for our audience, I want to explain what data silos are. So you have one department with one set of data, another department with one set of data, maybe a doctor who has patient data on his or her own laptop. And this data contradicts each other. What we need is what's called a one truth data. In other words, if you look up a patient, it'll have the exact same statistics, diseases, whatever it is, for that person. It won't contradict. And that works across not just medical, but every single industry. So, Roland, where do you see data silos the most in healthcare?
The most persistent data silos in healthcare sit between clinical, operational systems, and financial. You've got EHR or electronic health records, which are optimized for the care delivery and billing systems that are focused on reimbursement and operational tools that are focused on managing staffing and facilities and supply chain. But it's extremely rare that these speak the same language.
When they speak a different language, you're going to have trouble in the hospital. It could be ordering the right supplies. It could be getting a patient ready for surgery or anything like that. It could be billing. So does this happen in other industries too, like retail or human resources?
They're universal. They show up differently by industry, and in retail, silos exist between the customer behavior, inventory management, loyalty programs, and even pricing. Marketing might understand the customer, but supply chain doesn't, leading to stockouts, as you mentioned, and overstock. Human resources, silos are even more common. Recruiting systems, payroll, performance management, benefits for the providers. They all operate independently, and each system works well on its own. But as soon as you try to put them together, they fail, and they fail to provide you a full picture of what's worldwide in their health or for their productivity.
Okay. And we've talked about this in a few other episodes. We've talked about what's called APIs. So they're bridging data from different systems to other systems, and it's all supposed to understand each other. In practice, how well does that work according to your knowledge?
APIs are great when you're bridging things together. The biggest keys to them is a lot of times they don't grab the same information across the tools that you're using. So again, you'll wind up with fragmented data, or in the case of one particular customer, the data is inaccurate. It doesn't draw same time. It doesn't draw the right information in the right format. So you lose it in translation.
So you're not getting that one truth data or the clean data that's really needed. And
Exactly.
speaking of that, what's the process that you've used throughout your clients to get the right data to the right decision makers, the right clean data?
First and foremost, it starts with governance and ownership. All critical data elements need clear business owner and an agreed definition. Without that, qualities multiply downstream. So once you've got your governance and ownership, you've got to look at automation and standardization. Got to be common data models, validated rules, automated pipelines that remove as much human intervention as possible, and have to make sure that your quality is enforced. Not just
Okay.
patched, but at reporting time it must be enforced.
So those stakeholders must stand firm, and the adopters must stand firm with all the rest of the organizations, I'm going to assume.
Absolutely. You've got to look at that role-based delivery. Executives need their strategic KPIs, clinicians need their patient-level insights, and operators need that real-time metric.
And then another question for you along the same lines. So we have all this data for the clinicians, for the doctors, and so forth, and the insurance agents. What about improving the patient experience using data? What have been your triumphs in that?
The biggest thing for the patient experience is when the data removes all the friction. The unified data gives them a chance to have personalized care. It's proactive outreach. So when the doctors or provider knows what and when things may occur, and it provides a real smooth transition between them as well as their provider.
That is good because we talk a lot about ROI. But for healthcare, it's not just about ROI. It's about that patient experience. And using the data in the right way and using AI with that data is really going to help patients out there. All right, we're going to take a quick break from our sponsor, and we'll be right back. Chetu's Track to AI framework helps businesses adopt AI easily. In just 8 steps, you can unify data silos, maximize your ROI, and increase employee buy-in. Our experts will create a custom plan designed for your AI. Click the link in the show notes to learn more. Okay, we are back from our sponsor. Thank you to our sponsor. Hey, I do have a bad dad joke, of course, because we have to have one of those. I asked the medical chatbot for my medical history. It said to be patient. Sorry, not sorry. All right. So we're going to ask a question here for your clients. We talked earlier about governance, data quality, and security, of course. How do you implement that? How do you get the governance, data quality, and how do you achieve that one truth data? What's the process like for that?
It starts with leadership and aligning them on shared definitions and their accountability. Most people look at governance as bureaucracy. It's really not. It's really clarity. So we take that, we embed our automated quality checks and tracking so the users know where the data came from, how it was changed, and then there's security designed from day one, and not something that's added later. As you said, it's one truth data. It's not a platform. It's an operating model reinforced through the process, our technology, and our culture.
And I think it's a philosophy too that organizations really need. There's no more is there a need to have your own version of events on your laptop or on your personal cloud. It needs to be throughout the organization. I know people who keep their sales records on their Outlook rather than putting it into their CRM like Salesforce or something like that. And that is not helping them and it is not helping the organization. And I'm thinking that this happens all the time. You know, you have a doctor, he or she was used to putting it on their laptop and not putting it in the system. And that hurts patients.
Absolutely. It's the thought of keeping it near and dear to you, but not giving that information out to where the organization can use it to provide better care.
Yeah, that's understandable. And hopefully, throughout the process that you have there and going into these organizations, there's going to be a lot of training involved and a lot of attitudes needs to be changed. And I've talked on other episodes about fear of AI, but there's also resistance to change. Even in hospitals, there's resistance to new software, new technologies, and people would rather use their old trusted methods than use methods that work much better for you. We also talked about governance, and that has different meanings to different people. But governance with AI and data means that you have one standard going across the board and that you shouldn't go out of it. That sometimes produces what's called bias in data. And different people have different versions of bias, but bias means that you think one way and that one way doesn't apply to all people out there. And that's a very not good thing in healthcare.
The bias is the great killer of information. It's that destroys the true data and it skews outcomes.
Yeah. We definitely don't want that. And how do organizations navigate billing, insurance, facility expenses, supplies, and more in this new world of unified data?
The biggest thing for them is that they absolutely have to trust the data that they're receiving. Find the commonalities across the organization so that everybody is seeing real time, real information, and they're working strictly from that.
Yes. Um, Now, speaking of trusted data, there's data that's coming from inside the hospital, inside the emergency room or regular room. There's data coming from your regular medical doctor that you just visit. And there's also data coming from in-home healthcare and wearables, like my Apple Watch. So how do medical facilities, with all these outside and inside data, how do they stay compliant with regulations, and how do they make sure that that data is also one truth data?
First and foremost, it's all about compliance. So it's a matter of, you know, beyond who's accessing the data, but it's consent, security, interoperability, and clinical, validation. Most of the consumer devices like your Apple Watch, they're designed for personal insight, but not regulated clinical decision making. And healthcare organizations have to ensure the data is accurate,
Okay.
it's auditable, as well as that they have a liability coverage for that. They need to treat standardized formats and clear patient consent before they ingest any type of external data.
Okay. And then there's different standards throughout the world. How do you combine these different standards? So there is a standard in the US, there's a standard in Canada, and a lot of medical institutions are worldwide. They're not just in one area. How does that work, and how can you ensure that a facility is going to be compliant wherever it does business?
The key is connecting the activity across each part of the organization. So when the leaders are able to see how the delivery drives, their reimbursement, their costs, and they're able to manage everything in a unified format, that lets them understand and see the true value of that data. And they're able to support one another regardless of where the patient resides, regardless of where the pharmacy or the caregiver provides. All of that data managed, again, starting from the top down with governance, gives them a much better information, and it'll help improve how that facility runs, not only for the staffing but inventory as well as patient care.
Okay. And you did just mention a cost, and there is an investment when you unify data silos. I personally think it's a very worthwhile investment, and I'm sure you do too. But when you talk to your clients, how do you measure that ROI after we unify data silos?
The ROI from data unification shows up in various layers. So you've got your financial ROI, where you're reducing the claim denials, faster reimbursements, lower supply costs, and improving your staffing. Second would be operational. Teams spend less time reconciling reports and more time acting on insights, and reporting cycles shrink, from weeks to even minutes. Third would be your clinical and your quality ROI, reduced length of time in the hospital, fewer readmissions, better care coordination, and earlier intervention. And then finally, there'd be the strategic ROI. And this is the one where leaders are looking at, because they can gain better confidence in forecasting, and they align one version of truth in order for them to act and respond to any policy changes or needs in the market.
And this will help a lot with medical care because it's not always one doctor that you see. There's multiple doctors, and they need to know the exact same information in order to give you the best care. Speaking of medical care in general, there's a new legislation being proposed to Congress. It's called the Great Healthcare Plan. So if it's enacted, it allegedly could lower medication prices by giving subsidies directly to consumers. And again, allegedly, it could also lower insurance premiums. Now, I'm not sure what to make of this, but if you're in the industry, how do you think that will affect HSA platforms and even retail pharmacies?
Lower out-of-pocket costs would likely reduce the HSA drawdowns. This would shift the usage patterns from planning and towards more long-term health optimization. They'd still have to evolve a little bit beyond the transactions and more into advisory tools. When it comes to the retail side, you're likely to see a higher volume, tighter margins, which means you're increasing the reliance on analytics for pricing and inventory.
And then, mostly in the US, we have a healthcare system that the consumer pays for it, or the companies pay for it, or some way like that. And a lot of other countries have it where the government pays for it. And both of them need data. Both of them need AI. Both of them need to have lower costs. Will this work across the board as technology advances on both ways of paying for healthcare?
Absolutely. Regardless of who is putting the money out, having better data, giving you better predictive analysis on what may arise down the line, yeah, using AI means that you're able to stock better, staff better, predict the costs, and produce better performing medication. as well as provide better care because you're more efficient and you're more upfront for the patient end, which means they're going to lower their costs because you'll have less emergencies arising for misdiagnoses.
That's good. We won't have to wait for data, and we can still be patient, but we can be less patient. Now, I do have an AI myth of the week, and I'll let you respond to that first. Quote, AI will replace doctors.
I've never met anyone that married AI. But I will say there's doctors can utilize AI, but AI needs that understanding from the human intervention to care for a patient, understand sight, smells, the hearing from someone of what's really ailing them, as well as touch. And we're not there yet to where AI can perform all those duties of your at-home doctor as well as your physician who's seen you your entire life.
That's true, because AI doesn't have judgment. It's a prediction machine. It knows kind of what to say, but humans will always be in the loop. Humans will have that judgment. And I don't see that changing anytime soon. And AI doesn't replace doctors. It's going to augment them. The real value of AI here is helping doctors spot patterns in massive data sets, reduce administrative burden, and just make more informed decisions. Human judgment is always going to be there. In fact, I know of a case where there was an eye doctor, and most eye doctors, if they're lucky, they're going to see 2,000 or so, or 3,000 eyes, in their career. And I may be a little bit short there, but it's still about that amount. They, in this case, were able to spot thousands of eyes, and when they did the scans, it would compare it to those scans of hundreds of thousands of other people. So something that might be minor in the doctor's mind, the AI pointed that out. And of course, the doctor has to make that decision, but the AI is saying, hey, this dark spot here might mean this or that or something else. So AI is going to revolutionize the medical industry, and I think it already is.
Confirming a doctor's intuition is exactly what they want AI for, to assist them in what they do, not take over what they do.
What challenging data-related issues are medical organizations facing today? Like, what's the top one or two, and how do we solve that issue?
The biggest thing that's facing them, and some won't want to hear this, is they've got to trust the data. Solve it by investing in governance. Aligning their incentives and treating the data as an IT asset, not a byproduct. When they trust the data, they use it. When they use it consistently, that's when transformation follows.
Okay. And as far as the data is, there's one more question I'm going to ask here. We have what's called structured data and unstructured data. So unstructured data, you'd find that in emails, in a doctor's note, if that's legible, if there's such a thing. Then the big money in AI will be a program that can read doctors' handwriting. But in the meantime, you have structured data and unstructured data. And in your experience, we need both of those, of course. How did you get those two together to work as teammates?
The biggest thing from your structured data is obviously it's much easier to read. Those are your notes, the prescriptions that are there. Everything is black and white, what I'll call multiple choice. With unstructured data, it is really reading the thought process and understanding from the keys that are put into those information. So when you read an email from someone, it could be 5 paragraphs long, but there are probably 3 or 4 pieces in that really make sense to you. So that's what you look for when you're putting everything together. Is you're grabbing the keys from that unstructured data and mapping that with your structured data to come out to a desired result.
So they will merge, which is good. And 2026, it's the year where AI is here, but it's less of a thing and more of a process. It's on top of legacy software. It's part of your workflow. It's not something separate. And do organizations get that yet, or is it still a learning curve on that.
There's definitely still a learning curve out there. I think AI hit the scene like a pop star, and everybody loved it. Sounded great, but then people started going, okay, well, where can I use it? How do I use it better? And much like you mentioned about structured and unstructured data, it was more used in unstructured data, emails, help me be better there. Now companies are starting to look at, okay, how can I really make it a strategic asset? How do I make it work for me across my entire organization? Because each part of an organization needs AI to act differently for them to provide the best use across it, whether it be the motor pool and how do we geofence, how do we predict downtime on vehicles, and then obviously for staffing or payroll, and we've taught even incentives and rewards, understanding the customer better. So each department in an organization can utilize AI. It's, companies that help them, like us, understanding how to best utilize it, across the organization.
That is wonderful. And I really believe that AI is going to change our world as much as the internet did and make it so much better for medical facilities and for patients alike. So thank you so much for joining us today, Roland. It was an absolute amazing pleasure. Looking forward to seeing you on a few episodes in the future.
Thank you so much for having me, and, we'll get out and golf together and teach each other.
Thank you so much for tuning in today. Don't forget to follow us on social media at Track2AI Podcast. That's using the number 2, of course. And sign up for our email list. Go to www.track2aipodcast.com. And until next time, stay in the know and get on track. This podcast is for general informational purposes only. The views and opinions expressed by the guest are their own and do not necessarily reflect those of Chetu Inc., its management, or employees. Listeners should not solely rely upon the information provided and should consult appropriate professionals for advice tailored to their individual specific needs. Neither the host, guest, nor Chetu Inc. make any warranties, expressed or implied, regarding the information provided.